The Nigerian Correctional Service has raised alarm over a deepening mental health crisis in its custodial centers, with over 8,200 inmates currently suffering from mental illnesses. The concern was shared during a public hearing in Abuja on alleged abuse and inhuman treatment in the prisons. Dr. Gloria Sen, the Assistant Controller General in charge of medical services, revealed that many inmates begin to show signs of psychological distress almost immediately after incarceration. The system relies on trained inmate leaders to help identify some of these crises. Despite this effort, Esther says the shortage of medical personnel is critical, as one doctor often serves up to 1,000 inmates. Policy Officer, Hertford Foundation for Justice, Olagoke Esther, joins me to discuss this recent report. It's good to have you join us.
Thank you very much for having me.
Right, let's start with this recent report. The Nigerian Correctional Service disclosing that over 8,200 inmates are suffering from mental health conditions. From your own perspective, how does this impact rehabilitation efforts?
Just as Dr. Gloria Isian said during the Abuja meeting, the inmates, upon getting into the facilities, it takes a toll on them, being taken away from the society and being placed in the confinement of the prison walls. So this takes a toll on them. So it is very much possible to have these numbers from what she said, because going into a society where you're not familiar with, going into prison, it's puts a strain on your mental health. So you go into a place that you're not familiar with, and from all the reports we hear about correctional centers and all of that, so it's very much possible that this in turn happens. And as she said also, that 1 to 1,000 inmates. Take, for example, a correctional facility that houses 300 to 700 inmates or more than that. And these inmates have just one person responding to them, giving treatment and all of that. It also takes a toll on the doctor, the medical personnel, the doctor, the psychologist, or whoever is attending to them also. This in turn takes a toll on not only the inmates, but also the medical personnel too.
And for us to better understand this health crisis, beyond mental health issues, what are some of the other health concerns that have been raised going on in the correctional centers?
From a recent research that was carried out, more outbreaks of malaria and fever. Those are the health concerns that are common amongst inmates. It happens due to the environment, and generally anyone in society, behind bars or not behind bars, also face these things. But due to the fact of shortage of medical personnel, imagine 300 or more than that have malaria at the same time due to the environment they find themselves in, and they have just one doctor to attend to them. It is quite alarming, because just a doctor attending to all of these people at the same time is going to wear the person out. Because if everyone is complaining of same symptoms, it's even going to take a toll on doctor that he or she cannot actively run a test on everyone at the same time, because just the ratio is not balanced per se. One person to 300 or one person to 500, it is not balanced. So I would say that shortage of medical personnel is in turn affecting health crisis in inmates behind bars.
Let's talk about the role of community-based rehabilitation programs and also NGOs in supporting or complementing the government efforts in this.
The role of NGOs, I would love to commend certain NGOs like Esther Foundation for Justice, Olagoke Trauma Care, and other NGOs that give support to the correctional facilities, because these NGOs, they do not take the role of the federal government, but they only support, they only give help to these to the federal government, and they help out in areas where they can certain NGOs where they come in, like Dr. Glory Isian also said in reports where she said psychologists, they also come in to come and help the correctional facilities, and they also have the reports of these inmates when it comes to their mental health and others like that. Thank you.
Policy Officer, Headfoot Foundation for Justice, Olagoke, Esther. Thank you for talking to us.
Thank you for having me too.